Everybody to Extra. National Hospital Week is from May 12th to the 18th and celebrates the history, technology, and dedicated professionals that make hospital. GMH is always ready 24 hours a day, every day of the year. And the island's only public hospital celebrates National Hospital Week to remind our island of
the essential role the men and women of our hospital play in caring for our families, friends, and neighbors locally. Joining me now are event chair Alicia Ogo and also from the GMH Volunteers Association, Miss June Perez. Ladies, half a day. Thank you for joining us.
Thank you.
Thank you.
Okay, so I'd like to find out, before we get into the semantics of Hospital Week and everything like that, what do each of you represent, and what do your specific divisions do? Because at GMH, it's a big organization, even on such a small island, and everybody's got such specific duties and responsibilities they have to do. So what do you oversee?
I am currently the co-chairperson of Hospital Week 2013, along with Jason Boyd, pharmacist. My background is I'm an occupational therapist, as well as a certified hand therapist and chief of rehab services at GMH.
Very good. And I believe I know what you do, June, because the vest gives it away. Some of the nicest people you ever meet.
This is the frosting on the cake. This is, I'm here because our Volunteers Association very shyly stepped out of the interview, but we cannot celebrate Hospital Week, of course, without recognizing our volunteers. But I do work for the hospital. In addition to being a volunteer, I am a hospital employee. I'm a program coordinator, and I wear several hats of public information, pastoral care duties, assisting with guest relations, and any other special projects Mr. Verga would like to clear off his desk. I proudly received. But today we want to speak on all the wonderful work the volunteers have provided to us over the years. We cannot celebrate Hospital Week, of course, without celebrating our volunteers. Alicia is our chair for our Hospital Week celebrations, and today we're here to acknowledge the outstanding winners of the employee awards that have gone out, and we're supposed to acknowledge our volunteer of the year, who is your auntie Judy Salas.
That's
but
right.
She very shyly stepped back, so I'm here to make sure that the island community recognize Miss Judy Salas, our volunteer of the year, and Miss Esther Jong, our new lifetime member of our Volunteers Association. Everyone that contributes over 20 years of service, volunteer service, automatically becomes lifetime members, and that's quite an achievement. That's quite an honor for our hospital to recognize, and we welcome Miss Jong to our lifetime membership, and of course we congratulate Miss Judy Salas for our volunteer of the year, and all of our volunteers for the millions of dollars they've raised since 1965 in serving our hospital. This year, they just had an outstanding charity ball. They've raised a little less than $200,000 between their car raffle and the charity ball. They will be now purchasing another breathing equipment for the hospital and beds, brand new beds for the regular hospital units and the ICU expansion that is now underway. So they do tremendous, tremendous work, and we cannot allow a Hospital Week interview without mentioning their wonderful services to the hospital.
All right, very outstanding, well done. Alicia, is there a central theme, or like a dictum, if you will, that National Hospital Week is applying, so obviously throughout the country, and how does GMH apply that at the micro level out here?
Sure. This year's theme for National Hospital Week is a guiding light for changing times, and I find it really appropriate and really proud to have that as a theme, because the hospital has been the only civilian hospital for many years. But one of the goals of the hospital this year is inviting the new folks in town, you might say, the Guam Regional Medical City, and also the U.S. Naval Hospital, and other insurance providers, as well as healthcare facilities, to our opening ceremonies today, along with the Governor Calvo and senators, just to give credit to the hospital people, and to also show that the community is very concerned of the healthcare provided on Guam, and that the hospital is a resource that these new entities can come to, that we want to ally with to provide good care for our people.
Interesting question now. Is Guam large enough for more than one hospital? Obviously, we're having another one brought on by necessity. Because, you know, like as is the case, people here, you know, obviously they get sick, or, you know, bad things happen to good people, and, you know, they need immediate and urgent care. But at what point do you determine that a community like ours of 150,000, that, you know, more than one hospital is needed?
I believe if we just go and benchmark against a community in the United States, it would most likely be comparable. We would compare to the number of people in the population.
Okay.
So I believe it does justify, according to bed per 1,000 people here, that we have additional beds. And whether it's private or through GMH, it's appropriate to probably create more beds.
Okay, well, thank you so much. Well, we are going to talk to a couple of the outstanding employees of GMH and continue to talk about National Hospital Week and how our local hospital is celebrating it when we continue right after this.